Thank you for taking the time to tune in with us. Here on Unclamped, we recognize that every patient and caregiver carries a story, each one shaped by unique experiences, challenges, and triumphs. Before we dive in, we want to take a few minutes to introduce ourselves so you can get to know the voices behind the mic, the journeys that brought us together here, and the passion that fuels this space. Because this isn't just a podcast, it really is about community, and every story matters.
Welcome to Unclamped. Today we're talking about relationships, romantic, family, friendships, all the different types of relationships in our lives and how they evolve and change when chronic illness and parental or enteral nutrition are part of the picture. This includes how our bodies are impacted, how our relationships and roles change, how we communicate, all the intricacies of a relationship from the beginning to the end.
I think this is going to be such a great topic. I mean, especially coming off of Valentine's Day, where relationships and love are just at the forefront of everyone's mind. So I'm really excited to hear all about the different ways that we can help support people as they're navigating their relationships on this journey.
And today we have a special guest. Emily, could you please introduce yourself and tell us a little about yourself?
Hi, yes, thank you so much for having me today. My name is Emily Parks. I'm based in the DC area. My work history is in behavioral health and patient advocacy. A lot of my focus right now is in medical trauma. And with medical trauma, a lot of that can be the relationships that we have with our providers. And so this is especially an important topic right now because with Valentine's Day, we usually think of our more romantic relationships. But this is about all relationships. And that's really kind of, communication is the crux of really strong relationships, whether that be with your doctors, your friends, your support systems, and your intimate partners.
Thank you for being here. And so the audience knows, can you tell us a little bit about you personally?
Yeah. So I was born with a rare genetic mutation. So all of the smooth muscle in my intestine is just like really weak. So this primarily showed itself in my intestines. So I like to kind of think that my intestines were just kind of like wimpy. They were just really thin muscles, and they really couldn't absorb or move food along very well. And so as a result, I was on TPN myself for up until I was 27 because I couldn't absorb and digest what I was eating or enough of it to be able to sustain life on my own. So for much of my life was TPN. I mean, that was normal for me up until I was about 27, and I decided to undergo an intestinal transplant, which I'm very happy to say has been very successful, but it's been a big learning curve. So a lot of my personal background within patient advocacy is just the lived experience of being a patient and navigating it and being able to identify the gaps in our healthcare system and how patients can feel empowered and safe to say what their preferences are.
I love that. And that's exactly why we wanted to have you on. I think that you just have the perfect mix of the personal and the professional because in this world it's really hard to take advice from someone who hasn't lived it. It's one of those therapies and experiences that lived experience is so valuable and so rich. And then the fact that you have the professional background to support it, I'm just so thankful that you're here today. So thank you for joining us.
Thank you.
All right, so let's dive right in. What's one of the most common relationship challenges you see when chronic illness is involved?
I would find that the biggest relationship challenges I see is between patients and providers, and then patients and family members. And I think a lot of this has to do with just again that it is very nuanced and different living in the experience than reading it on paper or even viewing it. I can, say that I have a very loving and empathetic family. They've seen me grow up with this illness, but there are times that they still get frustrated with me. And so I think a lot of that has to do with, there has been some kind of breach or loss in communication in what it feels like going day through day with a chronic illness, um, and really how you as an individual with a chronic illness see yourself in the world. Because
Yeah.
sometimes there can feel that disconnect when we have so many people helping us. What is my place in the world? And we can kind of lose ourselves. And so I think it's continuing the communication to continue what the preferences are, what works and what doesn't work. And I think this all is just very important because this is something as sensitive as our bodies that we're talking about. We're not in the business of toasters,
I can really relate to that as a patient.
Right.
And as a patient who was diagnosed, we'll say diagnosed, started my really part of my chronic journey later in life, and being fully independent, very independent, and then having to learn to rely on other people. It definitely has changed the dynamics within my interpersonal relationships within my family and even my close friends. So thanks for sharing that. Could you talk a little bit more about the provider?
Yeah. So I find that as a provider myself in behavioral health, I see it all with a different lens. But then because I do have this patient experience, there are times when um, I'm able to kind of like there may be a client that is complaining about how staff is always late coming to visit them at their house, and honestly, a lot of the staff gets frustrated with that, and that's understandable because we're always kind of running late because there's always emergencies we're putting out. Um, but as a patient who has had home health and has waited very long times for nurses, I'm like, oh no, I get that. Yeah, I
Yeah.
understand why you want me there on time for the full time. Um, and because first you're going to use the service well. But also it is even for the clients that I work with, they have entire lives. They have entire ass lives. And I'm just there for a moment. But I at least can have the decency of scheduling it ahead of time. I think with patients and providers in these kind of large scale healthcare settings, because there is just honestly so much kind of policy and money in healthcare, and there's pressures on physicians to hit certain quotas, see so many patients this many time of day, that they can kind of get lost in getting those done. And then when you're so busy, what do people do? They start trimming the fat. They start taking away things that maybe they don't perceive they don't need. And so that's how I can kind of see communication can fall apart. Because if I'm a doctor and I'm just going with my team, I can understand where you can kind of keep going with that and not even stop to think about the patient, because I've unfortunately been in that situation where I've turned around and been like, oh my God, I didn't even talk to the patient. So it's easy to fall into. And I think that's why, especially for patients, continuing communication, because that's almost like putting yourself in front of your doctor and being like, look at me.
Yeah.
Right.
Yeah.
No,
I will not be turned away.
perfect sense.
Times I have done that as a patient, not literally saying, look at me, but I'm like, yo, I'm over here.
Sorry, I was just going to say, I love the fact that you can share both perspectives because you see it from the provider's like perspective, where you're like, oh my gosh, like just go, 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 but
Yeah.
also like the patient perspective. And I'm sure that that's one of the reasons why you're just such an excellent, professional in what you do. But how do you like So once you recognize that, like either as the patient or the provider, right? Like wearing both hats again,
Yeah.
like what are some techniques or strategies that you've used to like ground yourself in those moments and make sure that you're like checking all your own personal boxes to make sure you're doing your due diligence in the relationship?
Yes, absolutely. So first, I am a big personal user of talk therapy. I really have found it very helpful for myself. It doesn't work for everybody. I recognize that. But I do think that if it is something that you are thinking about, it is at least worth looking into, because one of the skills that I've learned in therapy is, and I use this skill whether I'm overwhelmed in my interpersonal life, whether I can't make a decision on how to move forward and with my medical stuff, or whether I'm just frankly overwhelmed with my own clients. It's the question of, what is my goal? What is my
I love
goal?
that.
And once you know what your goal is, and it's really, really boiling it down, and that goal can be, for working with my clients, it could be signing this paper that they're maybe too paranoid to sign, and so that's an hour meeting of talking about that. But it can also be something like, the goal is, I just want to feel more peace. And so once you are able to identify the goal, then the question is, how do I get there?
Mm.
And what is the actual plan? Not like, okay, because I just really fall back into the phrase as well of, those who fail to plan to fail. And so really, but it can be easy to think in a relationship when it's tough, like, oh, I'll just talk about this, this, and this. But then in that moment, it can feel overwhelming. How do I start this conversation? So if that means planning it out moment by moment, even bullet points, that's fine. And that can be in your uh, conversations with your healthcare providers. I know personally from my own medical trauma, I get kind of foggy brained and overwhelmed. And so sometimes a piece of paper is helpful, because my mind is going a billion moments, and this is at least something that I'm like, just read it.
I can relate to that for sure. Absolutely.
Having bullet points is I always go into a doctor's appointment with what are my 2 or 3 things that I'm asking.
Mhm.
Sometimes they sidetrack me and I end up not discussing anything besides the first one, because they'll
Yeah.
ask questions that lead down other things that, like, well, wait a minute, I saw these 2 at the end, and then I hand them the paper or I follow up with them in email later. But it's definitely having something tangible, and if it's on your phone or a physical piece of paper that you can actually leave behind, is I've found that personally helpful. So great tip.
We can also make these little bullet points for our, relationships with our families. If we're having
Mm.
struggles with our parent being too much of a caregiver, and maintaining your own personal boundaries because you're an adult and you want autonomy, and it's also overall better and more healthy for us to have and maintain our own boundaries. But the fact of the matter is, we sometimes need help.
Yeah.
So sometimes when you're in a stressful situation with maybe a parent that's your caregiver while you're an adult yourself, in those moments where I can think of, it's me and my stepmom. We get into little spats, and there are times when I think, okay, what is my goal with Sharon? And it's always to make the relationship better. How do you do that? And that can also take reflection. I recognize that during my recovery for my transplant, Sharon was doing everything, and I didn't vocalize how grateful I was. And now I'm more cognizant of doing that, even if it's not things that she's done for me, just to
Right.
slowly
So you
rebuild.
like see her.
Yeah, to be like she's
Yeah.
a welder, so being like, I always ask about her welding, or if there's a new statue. I don't know anything about welding. So it's perfect, she can tell me everything.
Yeah.
And this sounds like So she's an artist too.
Yeah, she's an artist.
Yeah, how would you say, like, I feel like oftentimes I don't know how to tell people that I'm thankful for them, or like I see them and I appreciate what they did for me, or do for me. Like, what are some like tips to tell people, or how do you tell people?
Well, let me ask you, what caused you to hesitate?
I don't know.
Well, I think sometimes, gratitude. I don't know.
Like, I think I instantly, yeah, like I just don't know how to, like, maybe I'll tell them later, like through text or
Mhm.
something, but I would like to in the moment. In the moment, I sort
The
of kind
moment,
of,
yeah,
yeah,
yeah. I think sometimes I find that it's hard for me to show that I'm grateful because a part of me is still a little embarrassed that I need so much help. And so
yeah,
it's moving past that embarrassment internally and being like, there's nothing for me to be really embarrassed about. Anybody in my situation would need help. And is anybody else embarrassed? Because I know personally, my brain is wired to be like telling me really bad things about myself all the time. So a lot of what I do is deflect it
mm,
and do a lot of like, so I think it's pretty understandable that there are times when people, have a thought that pops through their head, that they're like, oh, I'm a terrible person. And that can just pop in for whatever reason. But then it's taking those thoughts and thinking, okay, well, stop. What would define that?
yeah,
So, when thinking, okay, I'm grateful, I'm standing here, I want to say it, I don't know how to say it. What is stopping me thinking it? I will say it's a skill. So it sounds simple, but it's a skill of really being like, it's a, what my therapist would do with me is we would close our eyes and you would just feel what you feel. And so then thinking, oh, I feel embarrassed, and then challenging that thought.
hmm, yeah,
Because
I
there's
like
nothing to
that.
be embarrassed
Yeah,
about.
yeah, just
Hmm.
challenging what you really feel.
Yeah,
Yeah,
challenging our implicit bias.
yeah,
I love that, and being vulnerable. I think that that's a hard piece,
hmm,
Yeah.
that I see in my teenage daughter is that level of vulnerability, that level of, if it almost like if she says how much she appreciates it or loves it, she's almost afraid it'll go away. So it's just kind of like or that she's allowed herself to acknowledge that she needs it or wants that. You know what I mean?
yeah,
So I
It's a
think that that's
like
also a component.
acceptance into what we really don't want to accept, but really what we should, which is that we live with chronic illness and it needs to be managed. And it's like, I can definitely sympathize with that. There's been times when I've just been driving and I'm just like, dang, why me? Like, that sucks. And it's a very valid feeling. And I remember being, yeah, young and just, it felt like if I wasn't tough and angry, I was therefore weak. And that was somehow, it verified how weak I felt inside because I was so sick. So I was putting up this front.
Yeah.
It's
One thing.
insightful.
So one different perspective on this that I would like to hear your insight on is I do tell people thank you, and share, like thanks for the help or whatever, and they blow it off.
Mm.
So then I'm like, okay, so next time I'm not gonna thank you. So that is personally, like it's kind of hurtful when somebody doesn't acknowledge your gratitude. Um,
Yeah, most definitely. So what do they say specifically?
I mean,
Like,
they can go anywhere from like, of course, or why wouldn't I?
oof,
But it's not.
guilty.
And it's like, well, because a lot of people don't. That's why. Like, you don't have to help me. And take
yeah.
either one of these, Jamie or Gabby. They don't have to help their child. They only have to provide, like, they go way above and beyond what they actually have to do
Mhm.
for, especially Jamie's and her adult child now, right? Like she doesn't have to do this. She might feel like she has to, but legally she's no longer bound to take care of or do anything for her. So she could say, of course, that's what moms do, but that's not what all moms do. That's not what all people do. So, but I've had that happen, and it's really interesting
Yeah.
for the opposite. Like you're vulnerable, you say it, and then it's like somebody smacks you in the face.
I was gonna say it's interesting you say that because lately, like I'm a of course, but I don't know why I say that. But lately I've been saying you're welcome a lot more because I'm like I've been mindful of it. Yeah.
Yeah.
How do caregivers and like their partner, like what are some tips on how you just don't fall into like that caregiver only
Mhm.
role? Like,
Yeah, yeah. So
yeah.
I will say I have less personal experience with this in that I just have honestly less of a personal dating experience. But I find that with the person that I'm currently with, what I really appreciate about him is that um we have a shared experience, although it is not the same experience. And I think with that kind of I look for that in friendships as well. So there's this thing that I call the China doll effect. And it's when you disclose to somebody that you're sick and then suddenly they look at you completely different. Like you're a
Mm,
very fragile, breakable China doll. And the way they talk to you can change too. And I've noticed it usually shifts from the casual how are you to how are you feeling? Which after a while gets kind of irritating.
yeah.
And so one thing you can do to counter that, for example, is just to how different is the question, how are you feeling and how are you? So I would return the question and say like, "Oh, I'm feeling good. How are you feeling?" Which usually would then they would be like,
Yeah.
but there are ways you can respond to kind of, share something about you without being too like strong about it because that can sometimes feel confrontational and scary for those who are not um skilled in being confrontational.
And what would you say about like caregivers in general? Like, no, 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 but like just like me and my partner, we're just two caregivers, and like, how do we not just be caregivers, kind of just keep our relationship alive?
Are you a caregiver to a child or to
Yeah. Yeah,
Okay. Yeah,
9-year-old.
yeah, yeah. Okay, perfect, perfect. Yeah, yeah. Okay, so this is what my parents did, straight up. So uh kids are just naturally curious. And what they noticed with me is that as time went on, I became curious in my own medical stuff, and and naturally kids at some point they want to take on more independence. And so what my parents did is that when there were times when I said, "No, I want to do it," they would let me do it.
Hmm.
And they would encourage me to like, do all my own medical stuff as it was age appropriate for me to do it. And for what I couldn't do, they would do, such as setting up the TPM. But if there were times when I showed interest, they went with that. So it was them being my caregivers while also slowly introducing me to what I was going to take care of by myself. Because by the time I was maybe 13 or 14, I was taking care of most of my medical stuff by myself, except spiking the bag of TPN because I just wasn't strong enough, and driving
No.
myself to the doctor's appointment because I wasn't old enough.
Yeah.
And so as they would
Yeah.
gradually kind of give a little bit more responsibilities onto me, but if I couldn't do it, they would go in.
Yeah, I love
Um,
that.
I think another thing that really helped in my development as a child is, um, there were many times when I would wake up, especially I think more of high school, where you just don't feel well. And, the go to move, I think for a lot of people, is you call out sick the entire day. And so one thing that my parents had me do is I would just call out first or second period. Then you just run the fluids at home or do whatever you need to do at home. And then you go to school later. You don't miss the whole day. You miss as
Yeah.
much as you need to. So life stops when it needs to for your medical stuff, but that doesn't necessarily mean all the time. You can integrate it together. So a lot of what my parents did for me was kind of at first normalizing it and being very compassionate, but also a big message was you can do whatever anybody else can do. You just may have to do it a little bit different. So the idea was you can do it. You may just have to be you can go there, you just might have to get on the boat instead of the horse.
Yeah.
Right. No, I
Yeah,
love
but you
that.
can
And
do
that's
it.
what, right. No, definitely. And like
Yeah.
we've done similar things with the two teens. Like they have now built in accommodations into their 504s where they can actually, have a late start and it's not counted as a tardy and things like that. And, it's actually proven to have created a very good situation for my oldest, who's now in her freshman year of college, because she had that level of responsibility. Because it wasn't like you get a pass and you can't do the work, or
Mhm.
you don't have to do the work. It's, well, if you need that extra time, but you still have a responsibility as a student to get your work done. And now when she's on her own, she's like, I feel like that learning curve for a lot of typical children happens freshman year. Like, whoa, I got this freedom. I can make my own schedule, and then they fall out. Whereas
Yep.
like Olivia's like, I've been doing that since 8th grade. Like, I know that if I wake up and I skip my 9-10 class, I still got to do all that work. So
Yeah.
I think I love that your parents gave you kind of that sense of autonomy and letting you figure that out, because it's serving us well with Olivia. At least I know every child's different, but it really has made the difference of giving her that responsibility early
Uh,
early on.
I think it's very understandable and easy as a parent with a young child to kind of want to take care of everything, but in the long term, one day your child will hopefully live on their own. And with all children, we just have to set children up to be ready to live on their own when they become of age. And the only difference is for your child, Gabby, is that they could absolutely do it. They just may have to do it a little bit differently.
Yeah.
They just may have to tweak it and find their own way. But that's okay. We all find our own way.
So taking Gabby's question and pivoting it, and not looking at her and or them and the child, but pivoting it to the boundaries of her relationship with her partners, as both caregivers, but they also have another relationship. They are partners. And so there's two boundaries there, right? There's the boundary with being a caregiver with their son, but then there's also the boundary within the two of them in maintaining a proper partner, adult, committed relationship. And so what I've seen is people with chronic ill children often fall into, or I see it with parents in general, is they forget that they're partners first and then they're parents. So they forget that they're actual partners with their partner. They're not just the second part. So what would you say like about the partnering part of that? I know you said you
Or maintaining boundaries with each other while they're a shared caregiver for another person.
yeah. So like maintaining those boundaries of we are actually partners first. Like how do we maintain our partnership while yes, we are caregiving as well, but learning to set the boundaries between adult relationship. This is my partner who I choose to be committed to, and this like the different roles in our life. I guess is what I'm asking is how do you set the boundaries? How would you? Any thoughts on that?
Well, let me just first talk about the example of Gabby. Sorry that your example, Gabby. Um, but and I'll say this as somebody who's never married and without children, so I do not have firsthand experience on this. But my kind of top thoughts are you of course want to set boundaries and expectations. So whatever those expectations may be are to between you and your significant other, and that could be the distribution of chores, that could be who's better at what and who's more comfortable with what, because uh, some households both people work, in some households only one person works, and so what is the distribution of those caretaker tasks in addition to regular household tasks. But also I think really setting time aside as a couple. So if that means, I'm gonna say it. It may be, and it may not be, but I don't think it hurts to have a lot of sex, and that may help because it continues, closeness in what can be a a stressful situation, but you're working together,
Yeah.
which can bring you together. But you need those boundaries and those and if that means set date nights, if that means and it could be small things too. It could be you make each other lunch and then put a note in, or you call each other in the middle of the day at lunch just to talk to each other and talk to each other. It's okay to talk about the child, of course, and you should, but really also just being like, hey babe, how are you, how's your day?
I
Because
love that.
there's definitely stress for both of you
Yeah.
guys who work, or if one of you doesn't, then being at home is stressful. So how is it like for you, Gabby, today outside of your child? And
Mhm.
that kind of stuff. And then of course you keep the romance alive.
Yeah, I feel like that's how we've made it through. No, I was just gonna say that's probably how we've made it through. And yeah, I feel like a lot of times we hear in the community that like people want these like big date nights and like away for the weekend, and we've never
Mm-hmm.
had that, but we've done all those other little things to like, keep the spark alive.
Well,
And
yeah. And
yeah.
and that, for the family that is managing a chronic illness, that makes sense. But also a lot of people do more at home, smaller romantic dates now.
Yeah.
I can speak personally for me. It's more about the gesture than the expense. Although if my guy never brings me to Hawaii, we're gonna have a problem one day. But that we don't have a problem right now.
I love my Hawaii. So to summarize, it's really any relationship of setting time aside to have an appropriate relationship, or whatever that means. Showing, writing
Yeah.
notes, keeping the romance, if it's a romantic relationship, romance in the relationship, keeping the friendship, and realizing that we are a whole being that has multifacets and not just one part of our being.
Well, yeah, and then maintaining in your mind as well, what is my goal? And that can be throughout life, and that goal, always changes. And when I also say, what is my goal, because sometimes when we identify our goals, we identify that sometimes the relationships that we have no longer serve us. But then it's to really identify where you want to be in your life and the kind of relationships you want outside of judgment from other people. What do I want? And how am I going to get there? And it may be that the guy that I'm dating right now, that's not the way. But that's okay, because right now we're talking, we're laughing, we have good boundaries, we're having fun. But it's always maintaining what is your goal, because it's also very easy in relationships to kind of get lost in it and then later wonder how the relationship changed in such a way, especially when our relationships deteriorate. So maintaining what is my goal can also help you maintain a healthy relationship that continues to be healthy for you and that other person, whether it be a doctor, child, spouse, or friend. But the goal will always be different. Your goal for your friends is different than your children. I think the hardest question in life is always, what do I want?
So we'll take another pivot again, and we'll talk about, can we talk about blame? Because we're just really, it's really not that big of a shift, right? So we blame people all the time for not understanding us, when in all reality, we haven't told them what we want or need, or expectations aren't clear enough. So as a patient, we know it's hard to ask for help, for especially for people who had a later onset or didn't grow up with, like that wasn't their norm. So the opposite, right? So yours was at 27. 27, you had a major procedure, which shifted your life. At 27 is when I was starting my diagnosis journey of with mitochondrial myopathy. So I had to learn how to ask for help. So I couldn't do a lot of things. And that's really hard. And doing it, we were talking about this a little bit earlier, and, sharing, but feeling grateful, but not feeling like a burden to people. And I think a lot of people do feel like burdens, or, we were talking a little more about blame. We blame ourselves for having the disease potentially. So can you talk a little bit about how not to, yeah.
So I think first, when it comes to blame, it doesn't do much help to point fingers and shift blame onto an illness, because it doesn't change anything. It can be, there are definitely times when I've shaked my fist or I've been mad. But the unfortunate fact of the matter for my case is that, it was just a genetic mutation. And it's very hard. I personally find it hard to blame a mutation. They happen honestly all the time. So, but I do feel maybe a sense of guilt a lot in terms of the level of need that I sometimes have for my family, and I work on counteracting that by since my transplant, I've been closer to my parents, and in terms of having regular dinners, being incorporated more in their lives. And it's not so much things that I can physically do for them, but it's being a presence. And it could be like the little things, like, that I help Sharon with the dishes. It doesn't have to be these big grand things, but as somebody who lives alone, it can feel such a relief when you come home and somebody did the dishes for you. It was a small support, but goddamn, did it feel good when you got home and you saw that. And so then, if you feel, for moments when you feel like you're a burden, you can kind of think like, well, what roles have I taken on in the family alternatively? So, whether, I help maintain the house, whether, I always cook dinner. And I think a big identity for Americans is we identify ourselves by our employment, which is troubling when we don't have employment. And so then it's like, who am I if I'm not employed? Well, then you're a member of your family. So you can kind of think of yourself as, what is my role within supporting the family overall in a large scope? And then you're not a burden, you're part of it. But also, one thing that I do a lot with my parents is, my parents are in their 60s, so we talk about being old a lot, and, about their needs, because I know that they're going to need me. And so, and that is, not a situation everybody has, but I think for me, what's helped is even in the little ways, what can I do to help back? I mean, I'm sure even if I do the dishes, I don't live with my parents, but theoretically, if I did the dishes every day, they would definitely notice if I was gone for a week.
You might have experience with this because like you grew up with a chronic illness. How do you let me see how I can ask this. How do you not feel annoyed by like regular people and their regular first world problems when your life or like your problems are just so much more severe?
I think you could put that question in a post and give it to everybody. Because we all feel like we're in a world, dealing with, kind of knuckleheads that don't understand what we're going through, right?
Yeah.
I think again, it's that zooming out. It's that zooming out, and it can be. Don't get me wrong. Like I got a temper. Okay, like I just figured out how in therapy how to manage it, but I do, I have felt that kind of anger of because it's not so much the anger for me of not feeling understood. It's repeating myself, and you'll never stop repeating yourself because there's so many people in the world, but I think a lot of it is just kind of unfortunately kind of not unfortunate. It goes back to your ability and your level of insight and your ability to kind of step back and even if you're thinking this person is a knucklehead, they don't understand, as difficult as it may be in the moment, standing back and recognizing that while they have a privilege of having better overall health than we do, we have a privilege of understanding healthcare more than healthy people do. So when I talk to my healthy friends, and sometimes I talk about healthcare stuff, I can just tell that it's just not computing in there. And there is a part of me that's like, oh no, I wish you knew. You should know it would help you. But like I
Right.
recognize that I'm privileged in the moment that through all the kind of unfortunate situations I've been through, I've learned a lot about the healthcare system and probably can manage it and get through it a little easier because I've been in it so much. I just know a little bit more of the tricks of the trade.
I never really thought about it like that.
Well, and then also, I'm always a fan of a good sarcastic quib. So, you can always use it as a learning experience. I remember, kind of using humor to educate people. And humor can help because it can help people feel less embarrassed about not knowing about medicine, which I think some people can feel embarrassed about not understanding medicine because medicine is so intimate to our own bodies. So I think also some people, they don't know what to say. And so they may say something foolish because they just don't know.
Yeah.
That's a good point.
But then also it's totally fair to just like walk away from those people. You don't have to engage. You can just smile and walk away. And that's totally fine.
Yep.
Like I'm serious. As a patient, it is not our job to constantly educate the public. It's totally okay that if to smile and walk away if you just don't have it within you to deal with a knucklehead comment or say anything back.
Yeah, no, that is an empowering tip. I think we often forget that you don't always have to engage or respond.
Yeah.
So that is powerful. One of the questions that I have, and this is from both the dating aspect, and from just like having two teens growing up on TPN.
Yeah.
Is that like, when do you disclose it? Like when, like, you know what I mean? Like even with the kids when they were growing up and like if they were invited to birthday parties, like I almost didn't like, why do I have to, like, you know what I mean? And then it changes things and they don't get invited to the next one, or they don't get invited to the sleepover because the parent assumed, or when you're the patient and you're dating, like at what point do you feel like it's necessary?
I think dating, because dating is a very intimate agreement between two people. My practice is just disclosing right away. But also, I'm at a different age. I'm in my 30s, and people are my age that I'm dating are generally more accepting and mature than maybe people who are in high school and dating. So high school can be really tricky in terms of disclosing with friends. I figured out very quickly that the simplest terms that I could put in was the best. And I would always just kind of put it very simply as, I can't absorb anything I eat or drink. So so I do this TPN, and then they'd be like, what's TPN? I'd be like, imagine everything that you need in your nutrients in a day. It's in a bag, and I infuse it. And not really sharing more than that, but there are also, I remember friends that individually showed their personal interest. And so they learned more about it. I had a friend who even set up my TPN for me. He was so interested. I didn't run it. And then he got offended. He was like, "What? Why are you dumping it down the sink?" And I was like, "'Cause you're an infection risk. That was your first time." I'm not bra, no. But there are people who are gonna naturally show interest and naturally not show interest, and I think the people who show interest, they're more subtle because they ask the question. So I in my dating history, I have disclosed immediately, I have an intestinal transplant, and it can be a mixed bag, and it can be a hurtful bag. I've had guys who have just, I think the most shocking thing to me is when guys have broken up with me, but they haven't asked any questions. It's clear that they broke up with me because of my transplant status, but they didn't ask me any questions. It was just maybe a feeling for them that this was too much for them to handle. And so I think with that, I've learned to kind of, my best friend growing up had diabetes. I mean, the man I'm dating right now has diabetes. And so maybe it's also connecting with other groups that aren't exclusively just our diagnoses. The diversity of people around us. And, that goes for people who have, chronic illnesses such as diabetes, which is very different than what we have. But also, I dated a very lovely man who, his cousin got a lung transplant. So you can just kind of be surprised by what people know from their personal experience. But with that boils down to that person's ability to be open. And, some people are just open to experiences and some people aren't. And that's what we have to deduce while we're dating any of us in any situation. What is your type? Adventurous or consistent? Not to say that they can be opposite, but
which leads me to a question. We're talking about disclosures, right?
Yeah.
And you also mentioned sex earlier, but the physical body disclosure. So there's verbally disclosing, and then there's physical body disclosure as well. Yeah, that's, for me, it's different because I was already with my partner.
Yeah.
When, I got my central line and stuff like that. So it wasn't I wasn't disclosing my body for the first time and the central line. So it's different. But for those who who are on a for those who are disclosing their body that has been through, or who has a central line at the first time, do you have any tips or communications or how you would prepare or how you did prepare your partners to see that ahead of time?
Yes,
you don't
absolutely.
want to do it in the moment, right? I would think you'd want to have the conversation, disclose some before you're going to be physically
Yeah,
intimate.
it's a gradual process. So I think first it was an internal work for me because I definitely did not feel desirable because of my healthcare problems. And so for me, it really started with beginning to see myself as beautiful and sexy. And so that was specific decisions on, what kind of style of dress I want to be in, what, my hair, the makeup. And then I got really, really into lingerie. I bought so much lingerie. And I think even just like just casually walking around your own apartment in lingerie, there can be an empowerment of that. Because you can even just like pass the sight of yourself in the mirror and your brain might immediately be like, ooh, hello. And then you turn around and you're like, wait a minute, that's me. Hello. And because confidence, people love confidence. People are attracted to confidence. And it is a vulnerable position you're putting yourself in. So by doing that kind of internal self work, and I'm sexy, and I've also done boudoir photos. There ain't no harm in hanging around on one of those dating apps, and just getting compliments if you can, and giving compliments. You don't actually have to meet anybody, but you can, just they're people just like to talk to each other sometimes, or you can just kind of feel good without having to meet somebody while maintaining your boundaries in those dating apps. But I think it was with that made me feel more confident in explaining my body to somebody else. And then with
Yeah.
my current partner, I think with a lot of, you there's a lot of touchy grabbiness before you get to any action, and that's how some things get discovered, and then
Mm.
that's how the conversation is. But one thing that I really appreciate about the person I'm dating is he direct. I'm a little avoidant about my G tube, and he was like, "Can I see it? What is this? What's that?" And he was like interested, like genuinely interested. And he was like, "That's so cool." And he's like, "Can I touch it?" And I don't know, it was like kind of funny or something. It just kind of then I wasn't feeling weird,
Yeah,
you
because he's
know?
asking questions from pure curiosity and not
Yeah,
necessarily sexual curiosity, or
exactly.
it's
Yeah.
just getting to learn you as a person
Because he was
first.
like, "What is this? What?" I had to send him a picture of it and everything. I had to explain. He was like, "Wait, so how does the?" I had to explain that. Like, I was like, "No, the whole thing is tunneled, and there's a balloon that inflates." And he's like, "But how?" So it was more of a discussion of how is a Mickey button constructed more than sexual in any way. It's more of him just losing his mind over the invention that is a Mickey button, which is also really adorable.
That
So,
is that is definitely an adorable, especially for a scientific nerd like me, like how something is invented. So
yeah,
that's
Mickey buttons have been around forever and he's losing
yeah,
his mind.
yeah.
It's cute.
So basically, what you're saying is it's really no different than disclosing, or your normal teenage, your first time, kissing
Yeah.
and hugging and
And I think it's a lot of when you're
hands roaming.
dating, you really do, as kind of when you're dating, and if you're newly dating and you're really kind of swept up in the emotions, things can get really kind of get fuzzy. But I think, dating, especially with chronic illness, it's very important to really kind of observe the responses of the people that you're dating with, especially at the very beginning, because they'll learn more and more as time goes on. We are uh we're adventurers. We're adventurous ladies. It's not set in stone, where if you're gonna be with us, you're gonna go for a ride. and and I think in those early dating phases, just identifying what kind of person who this is without judgment, of course, and just subtly and accepting them for who they are. And if it's not a match, it's not a match. But I understand the pressure of wanting to kind of hurry up and find somebody. But it just
what age you're, if
yeah,
you're,
it depends on what age
if you're
you're
14, 15, 16, teenager, please take your time. But as
yeah, but like 20, sometimes 20 something year olds
yeah, I mean,
immediately
and
get
then
married.
30-year-olds, you always have the worry of, and it doesn't matter if you have a chronic illness or not, then you always,
Yeah,
and you're a female, you hear the clock is ticking. And even if you don't want necessarily kids, it's still how
yeah.
society pushes onto us. So,
And I think what you're touching on is that there's this idea of marriage, and then there's what marriage really is, which is work. But I think, especially I can speak for myself. When I was younger, I was like, it's idyllic and perfect. And now I'm like, he won't stop texting me.
no relationship is idyllic and perfect. It doesn't matter if it's a friendship, a romantic relationship. Idyllic and perfect is all in the eyes of the beholder, I would say.
Well, exactly. And that's the whole thing about these relationships is you, the eye of the beholder is you. What do you want? And what's the path you're going to take to get there, and keep your eyes clear and observe the people who are around you to have, really kind of interesting, fulfilling, developing life with people that help you grow and stretch, but also support you. But it takes work. I think one thing that we struggle with chronic illness is we can't always show up. So how do we, again, I can do anything anybody else can, but I may have to do it differently. I can't always show up physically as a friend, but I can show up in other ways. In other ways that some of your other friends may not know how to. So it's, again, we can do anything anybody else says. We just may have to take a little bit of a different path. But that's okay.
That's how I describe everything. We're all different. So just finding our differences and finding our way through our life, because nobody's journey is the same. It doesn't matter if you're a chronic illness or not. So.
And we're all making it up as we go along. I find a lot of solace in that. Sometimes when I'm really like freaking out and being like, everybody can tell I'm freaking out, it's a helpful reminder for me to be like, everybody's figuring it out, and people are not paying as much attention to me as I think because they're figuring it out. They're too busy.
100%. Well, Emily, I feel like we could continue this conversation, but it's been so great having you. I mean, you are so insightful. I'm just so thankful that you came on tonight and you were sharing your wisdom with us from wearing both hats. So, so thank you so much. And
thank you for having me.
Yeah, I hope everyone can take away something, and realize that relationships are a lot of work, and that it takes time, but we're not as unique necessarily as we think we are. All right. Well, thanks for joining Unclamped, and we'll see you soon.
Okay. Thanks, everyone. Bye.
Thank you.
We want to thank you for tuning in with us on Unclamped. We hope today's conversation reminded you that every diagnosis holds a story, one of strength, compassion, and connection. We want to give a heartfelt thank you to our sponsor, AvivoRx, for their commitment to supporting patients and families through their nutrition support journey. Their dedication makes conversations like this possible and provides a platform for the patient voice. We'd also love to hear from you too. If you have a story to share or a topic you'd like us to explore, reach out anytime at nutritiongroup4all@gmail.com. And be sure to find us on YouTube, follow along on our social media, and listen wherever you get your podcasts. Thank you.